So what is functional medicine? Most people find our website because you do something called functional medicine, but really what is it? In a nutshell, it's to get you to function. Most people have pain, or they can't move, or they don't sleep, or they have brain fog, but they're not functioning. They can go to work, or they can be a mom or a dad, but they're not functioning. So the idea of functional medicine is to get you out of that crisis care and move you on. The problem with functional medicine is most functional medicine doctors just trade a pharmaceutical for a natural aid. You manage the case, but are you really functioning? What if you don't take that supplement? What if you don't eat that way? You're not staying in a functional state. So our job is to get you not only functioning, but to get you to actually be beyond functional medicine and actually heal yourself and get better. Remember, you're supposed to be healthy. That's the way that it was intended when you were made. So we get a lot of questions. Do you take insurance? And unfortunately, no way. Not going to be in the future, ever. The reason we don't take insurance is insurance right now still does not want you to be healthy. That's the way the rules are. People get paid when you're sick. I don't want you to be sick. In fact, I want you to be healthy. You should expect to be healthy, and that's the purpose of being here. So we're not taking insurance. Last year we did a study and a survey we sent out to all of our patients and said, hey, what can we do better? What can we bring to our practice? Is there something that we're not doing right, or we can be more efficient? The cool part about that was our practice got a 95% satisfaction rating. That doesn't happen in very many practices, let alone the functional medicine world, because there's a lot of things that people come in with and they may not respond to. In our office, we have a lot of tools. I understand you won't respond to this thing or that, so we're looking at, from your history, what can we do to get you better? That's where our satisfaction comes in. And that we're very good, and we're very blessed to have a wonderful staff and people that actually care. They have their own story, and they want to get you there as fast as we possibly can. So the question is, again, what do I do? If you didn't get our mechanoreceptor stimulation is really what I do. Of course, that won't go big at home. Hey, I went to Dr. Trites. He does mechanoreceptor stimulation, and what is what you're going to get at home? The skinny is, I fix muscles. We evaluate the body, we fix muscles. The muscles have a correlation to the nervous system, and that's how we reverse and fix disease. Now, that muscle might have to be fixed by diet or exercise or a supplement. There are other ways to fix muscles than actually working out. So that's what I do. I fix muscles. And those muscles we get fixed are what's called adaptations. For instance, if you have a car and you go to a parking lot and then somebody opens the door and it creates a door ding. That's what happens with muscles, or over life when you have chronic inflammation or pain or you abuse your body. You get door dings. What I find in your body are those door dings. Those are called adaptations. If you remember, you probably stubbed your toe at some point in your life. It hurt. Then you walk around for 2 or 3 days, and then you twist or do something or push up on your toe and go, oh, what? Ow, that hurt. That's the adaptation at play. The mechanoreceptors are still there going, you really injured this, but you had forgotten about it. I go find those spots, and I'm sorry when I do. I already know, I'm sorry this is going to hurt. I get that mechanoreceptor stimulated so that the pain goes away. That's how it works. I fix muscles, my mechanoreceptors, and I fix you. So Cleveland Clinic and Mayo Clinic and Stanford University have been adamant about classes. They have found that their patients get better if we have a whole bunch of patients who have genetic problems, or they have weight or blood pressure problems or diabetes. When you get a group of those people together, collectively they get better faster. So in our future, we will start to bring classes together in our office. Right now we offer other programs. We offer our Shape Reclaim program. This is an anti-inflammatory dietary program that we monitor your neuroanalysis very closely to make sure that we're dampening the inflammatory responses in your body. The side effect is you usually lose some weight. The most important thing is you lose the inflammation, because inflammation is the root cause of most diseases. For instance, remember, symptoms are 10% of the problem. How many people in your life have you heard have gone to the doctor to have a routine test to be followed up with whether they have cancer or they're having a quadruple bypass surgery and they failed their stress test? Happens all the time. Why? Because inflammation isn't always pain. It's only 10% of the problem. In our office, we have a scope of practice. SCOPE is an acronym. So I do structure work, mechanoreceptor stimulation. We do chemical work. I look at blood tests. I look at your nutrition. I hope to bring on some other doctors that more are in the chemical world that do pharmacy. So if you have to be on this medication, is this perfect for you? Does it work with your genetic output? We have organ work. Again, that's blood work and urinalysis that goes with it. We have a stress component, but we call it psyche stress because that's how you make an acronym. It's not really P. But stress. If there's too much stress, then a stress hormone called cortisol comes up, blocks hormones, decreases gut, puts you into a sympathetic dominant state, not a parasympathetic state, and then you have problems with pee, poop, sex, digestion, immunity, blood sugar, and blood supply. So we have to address that. And then the other component, the bioelectric component. When we're testing your body, we are testing those mechanoreceptors, which are electrical signals that go to your brain. So it's bioelectric. Sometimes we have to stimulate something called an acupuncture point. In our office, while we do have needles, for the most part, we use an acupuncture laser. Why? On functional MRIs, we can put the laser on a point for 15 seconds and get the same results as a needle. Most people are very appreciative of that. So in our office, how many acupuncture points, how many mechanoreceptors can I stimulate in a 15 or 30-minute session? It equates to about a month's worth of chiropractic or acupuncture work. That's why we do what we do, and that's what we charge, understanding that that's the stimulation that we need to get you over the hump. At times, we have to use little blocks that go underneath your pelvis. Again, that's mechanoreceptor stimulation to the pelvis to balance the pelvis, which is the base of the spine and the nervous system, to get things moving. Or you might see me use a little clicker or a gun called an impulse gun, all based on mechanoreceptor stimulation. The other classes that we will have will be for autoimmune. Why did you get an autoimmune? What are we going to do about it? How are we moving forward and how are we testing? If we're not getting where we want to go, we will also look at your genetic makeup. And that'll be looking at your family history and what creates expression. Expression is created by your lifestyle, your environment, and even your parents' lifestyle when you're, and even your grandparents' lifestyle can have all an effect on the genes. But if you have to be in the genetic program, there will be a class for that and there will be an online portion to it. Again, welcome to our clinic. I look forward to helping you and your family.